Knee replacements is expected to climb nearly 640% in the next 6 years. 23 News reporter Bria Walters talks to experts about the shocking statistics and whether the medical community is ready to handle the workload.
Hip and knee replacement surgery are two of the most successful surgeries that are done in all of medicine. And they're very good surgeries, but there isn't a perfect surgery.
Doctors perform nearly 790,000 knee procedures every year, and those numbers will rise. Dr. Jeremy Fletter with Ortho Illinois says we can chalk it up to age.
The U.S. has an aging population, and so most of the hip and knee replacement surgeries we do are due to osteoarthritis, which is wear and tear arthritis. So there are exceptions with younger people, but in general, it's the aging population that develops this wear and tear disease. And so as we have older people in the population, we end up doing more hip and knee surgeries.
According to Mayo Clinic, 32.5 million American adults must deal with osteoarthritis. Dr. Fletter says there is no one reason for that.
It's multifactorial, so there's a genetic component. Some people are predisposed to have their joints wear out sooner. Wear and tear, so the activities you do may bring it on faster, but we also don't know exactly what brings it on, and certain people just tend to develop it as they age.
Experts say even after knee surgery, many patients may still suffer with chronic pain, but new technologies and medications offer some hope.
We don't have a perfect way right now to prevent arthritis from developing. There's certainly research going into that. We have a lot of different tools for treating hip and knee arthritis without surgery, and I always try to exhaust those in patients before we turn to surgery as an option.
Working for you in Rockford, Bria Walters, 23 News.
Experts say with the number of total joint arthroplasty procedures rising, provider supply is very limited.